Welcome, friends. Welcome back to What's Behind the Silence, the truth no one wants to talk about. Today on our podcast, we have Dr. Khan out of Novi, Michigan. He is a plastic surgeon and also a specialist in BII, Breast Implant Illness. Welcome, Doctor.
Thank
Welcome,
you very
Dr.
much. I
Khan.
appreciate it. Thank you. Thank you very much for having me. It's a delight and a pleasure to be here with you discussing a topic that is very controversial, but something that is very real. And it afflicts millions of patients, and many of which who do not know that it does exist, breast implant illness. Yes, please.
So, Dr. Khan, can you explain breast implant illness and who it affects and what are the effects?
Sure. So I just want to go ahead and start off by a brief introduction about myself. I'm a board certified general surgeon. After having done my boards in general surgery, I did my plastic surgery training, and I'm board certified plastic surgeon by the American Society of Plastic Surgeons. My practice basically is now exclusively almost 95% what is breast implant illness management and essentially explantation, how I do it, why I do it in the manner. And as you will see, we'll get into a lot of details in regards to what is breast implant illness. Breast implant illness is a constellation of signs and symptoms that the patient exhibits, sometimes soon right after augmentation, or maybe sometimes 5-10 years later, where the patient starts exhibiting signs symptoms of hair loss, migraine headaches, and I'll go head to toe down, where they have vision dryness, eye dryness, vision problems. They have throat clearing, changes in smell and taste. They have problems with neck and back pain. They have memory loss. The psychology of the mind is also affected in the sense that depression, anxiety, mood swings, emotional instability, suicidal ideation set in, very well defined. There is no denying the fact, as you will see, and when you dwell into and listen to the many ladies, chest pain, palpitation, difficulty breathing, shortness of breath, difficulty with exercise, arrhythmias. You have the hallmark feature of what is joint pain, the arthritis, the chest pain, which is basically the silicone mastitis. You also have the many signs symptoms of GI distress, irritability, not being able to tolerate foods that people used to tolerate before. You have the skin rashes. You have itchiness, for example, that comes in and sets in. You have problems with tingling, numbness in the arms and legs, carpal tunnel type symptoms, EMG all being negative. You have problems with endocrine system, where the thyroid imbalances occur, the adrenal imbalances. You have signs symptoms of fibromyalgia. If there is no other diagnosis, then everyone gets labeled to be a patient of fibromyalgia, suffering from the many signs, symptoms, and variations of fibromyalgia. You also have the reproductive cycle that is affected. Many patients, as you will see, who have had basically premature menopause. There is mention in studies, for example, the big MD Anderson study out of Houston, Texas, where a publication was made of 100,000 patients. It's a study of studies where they look at patients, 100,000 that had implants, 80,000 had silicone implants, and 20,000 saline. And they concluded that the ladies had 4.5 times chance of stillbirth if they had implants. Now, this is a study of studies, but this is real documentation, hard evidence, if you will, where almost every single cell of the body is affected, some more, some less, some basically reporting one organ system being affected more than the other, from plantar fasciitis, neck, back pain, like I said earlier, to lower extremity pain, and a lot of ailments that result, which are very classically consistent with what is breast implant illness. And this is what's interesting, where the FDA, when they put forth the warning in their 3 warnings, i.e. in regards to breast implants, they concluded, number 1, that they're not meant to be in the body forever. Number 2, that they're associated with lymphoma, the BIA, breast implant associated anaplastic large cell lymphoma. And the third point that they mentioned clearly, this is the breast implant illness, that the patients who have breast implants suffer from these constellational signs and symptoms acknowledged and accepted by the FDA and clearly highlighted by the many, not only hundreds of thousands, but millions of patients who have breast implants who are getting them out now at an exponential rate of increase compared to the many years in the past.
Dr. Khan, so that's a lot of symptoms for a woman. So if someone was having some of these symptoms, at what point would you suggest for them to say, hey, I think I need to check out BII? And because a lot of these symptoms can be other illnesses and diseases. So what would you say to them?
So I tell them, absolutely, we have to rule out. There are millions of people who have, for example, Hashimoto's thyroiditis. And I'm not saying if you get implants, you get Hashimoto's, but I say go see your primary care doctor, get the lab workup done, get seen by the rheumatologist, the endocrinologist, the allergy immunologist, make sure that you don't have arrhythmia or basically, multiple sclerosis, for example. You must get your workup. Now, this is basically a trend in the many patients with BII. They go to the doctors, they get all the lab workup done, they get the imaging done, the MRI, they get all these tests, and the tests say everything is normal. You're good within normal limits. There's no problem. And then inevitably, the doctor says, well, this is too much stress in your life. You got 3 kids. You're suffering probably from COVID. You had that 2 months ago. This is a sequela, and everything gets blamed to everything except for implants. Now, when I see my patients, I myself screen them and I make sure that they have been, quote, vetted, they have been assessed, evaluated, managed, and a full lab workup, history and physical exam has been done by the primary to make sure that there is no misdiagnosis. Now, once the patient comes in, there is no lab diagnosis, there is no blood work, there is no imaging diagnosis, but we have what is a questionnaire where I myself prepared this questionnaire where I basically list all these symptoms that I highlight, from brain fog to fatigue being the most common. And then I simply have the patients check on that questionnaire the many symptoms that they're suffering from. So classic example, 35-year-old lady presents with, say, 33 out of the 55 symptoms. We know this is all suggestive and indicative of BII because she doesn't have diabetes, rheumatoid arthritis, MS, all these other problems by default. And then, as we clearly see, the lab workup, the patient has the medical clearance. Only then do I proceed with surgery once all these other medical ailments have been physically and via lab ruled out. When I use the word physically, meaning by a history and physical exam, or the patient actually actively walks in and gets assessed by the healthcare provider.
Okay. So, many women are suffering from this. And, if it's not taken care of, what are some of the long-term effects that can happen to them?
So depression, weight gain, joint problems, believe it or not, many ladies, unfortunately, suicide, they continue to hurt for years and years and decades, and they are not aware that there is actually a solution to it. Now, what I mean by a solution, that means a cure. You look at the studies that are coming out, the preliminary studies that are being now even reported in the plastic surgery journals, well over 90% of these patients benefit and improve from explantation, which is removal of the implant, plus the capsule, plus all inflamed tissue. And it is imperative, this is the gist of this podcast and this discussion, that the entirety of the implant, plus the capsule, all of it, must faithfully, sincerely be removed along with all inflamed tissue, such that there is no inflammatory burden left behind, and that once the surgery is done, the patient is free and void of all these symptoms of the silicone toxicity, so the patient now can essentially normalize and equilibrate to a normal state of good health.
Dr. Khan, you guys do any type of biopsies on the I don't want to say debris, but the implant and the surrounding tissues? Do you do any type of biopsies on that?
So the biopsies can be a little bit tricky. simply because, in the process of doing a biopsy. So I just reviewed a case today. This lady came in and she had a mass of her breast tissue. Now remember, 1 out of 8 or 9 women are going to get breast cancer. So I don't want to be operating on someone and they have not had a mammogram or a breast exam. So she could not get a biopsy simply because it was in the close proximity of the implant, and they do not want to rupture the saline implant or a silicone implant for the matter. And there are times where an open biopsy may be warranted. Or is warranted in breast cancer or patients who have implants and who have masses, because sometimes the imaging can only tell us so much. And any mass of the chest, especially of the female, the breast tissue must be biopsied in order to conclusively prove if this is breast cancer or not. So I do not biopsy, but I send my patients to the breast center where a biopsy, if not a open biopsy, can be done in order to rule out any breast masses. I do not. So a patient who has a normal mammogram, and in some select cases I require MRI, if that is unremarkable or an unremarkable physical exam and there is no suggestions of cancer, then I essentially explant, that is, remove the implant plus the capsule plus all inflamed tissue. So I do not get a biopsy. Now, there are patients, for example, that come and they said, well, I felt a mass in my armpit, my axilla. I tell them, go get a biopsy of that, because God forbid that could be breast cancer. And a general surgeon can selectively target with ultrasound guidance, make a small incision, remove that implant, send that off. That way we can tell definitively that this is not breast cancer. Obviously, the patient has gotten the breast cancer workup. Now, sometimes I say that lymph node needs to be assessed also for silicone, because if a patient has a rupture, then the silicone has clearly been shown to migrate into those lymph nodes, and that will be a very clear indication of what is the status of the silicone or the saline implant.
Okay. Now, you had said that you can get cancer that's not breast cancer from the implants. Is that correct?
Correct. So I want you to read the second point that the FDA mentioned, which is what I read earlier, which is there is a direct, clear association of textured implants and also smooth between implants causing direct causation and an effect of what is breast implant associated anaplastic large cell lymphoma, which means that this patient with the BIALCL, had she not had implants, she would not have gotten the cancer. So the implant caused the cancer, period. So this has been shown more so for the textured implants, which has now been banned by France first, and then the US soon thereafter followed suit. And not only with textured implants, but also smooth implants that have been associated with lymphoma, which is the reactive lymph tissue in regards to the body fighting off what is a foreign body, and hence the immune response to lymphoma, the lymph cells, i.e. the lymphatics being affected. Now, this is a very complex type of a cancer. The medical oncologist absolutely gets involved along with the breast center, and the treatment of choice is to remove all fluid and sending that off to cytology to look for CD30 analysis, which is a special stain, to send all of the capsule, again, 100% of the capsule, to pathology, because that is the cure, and to leave none of that cancer behind, and to free the body of the implant and plus all inflamed tissue in the periphery, which is basically what I do. And clearly, it has been shown by the FDA and the medical literature that the BIALCL, which is the breast implant associated anaplastic large cell lymphoma, cases have been way underreported. In my literature review, I saw there were approximately 430 cases. Then recently, I saw there were 733 cases to date that have been reported in the world with BIA. And then this past weekend, I was doing my reading. There have been reports of almost 1145 cases now of BILCL. And another thing that has been clearly established, this number is way underreported because not all the plastic surgeons and not many plastic surgeons send the capsule off to pathology. And if you're not checking for the CD30 analysis of the capsule for lymphoma, you're missing the diagnosis. And there are many cases certainly that have been missed, and the society, the plastic surgeons, and the FDA clearly acknowledge the fact that is absolutely the case. So there are many unreported cases as a result.
So not everyone. So if I were a woman that was, worried that this might be happening to me, are there a lot of doctors across the US that specialize in this?
In explantation?
Yes.
Yes. So this is a new concept. If you talk to the vast majority of the plastic surgeons, they will say that this is a myth, unfortunately, even to this day, and that it's only a fraction of the people that are affected by what is a social media phenomenon, breast implant illness. And unfortunately, this is the vast majority of the other primary care physicians and also the subspecialists, the immunologists, the rheumatologists, the allergy immunologists, for example, the endocrinologists. They don't accept this to be a real entity, if you will. Now, you would expect the plastic surgeons, since this is their specialty, to step up and acknowledge its existence. Now, clearly, it is becoming more and more recognized in social media. If you look at, the Google Analytics and the review, they did a search of breast implant illness a few years ago, and now it has exponentially increased, and now augmentation is no longer the number one plastic surgery procedure. Before, it used to be. Now the number of explants have gone up significantly. Now, as a plastic surgeon, I will tell you, a board certified plastic surgeon, I will tell you that this is not what we are taught in our training, what is an end block or a 100% total capsulectomy. What we're taught is if you see lymphoma, 100%, the standard of care is to remove the entirety of the implant plus the capsule, 100% of it, plus all of the fluid. And if you don't, it is considered malpractice because you left the cancer behind. This is when you conclusively have proven that this is lymphoma. Now, in my practice and in the practices of some select surgeons who are doing it right, and there are only a few of them, you will see that once the capsules are removed definitively and comprehensively and with definitive absolute certainty, then only is the patient bouncing back to a normal state of good health. In the many patients who have gone to the many plastic surgeons who said, sure, I will remove the implant and the capsule, and they left part of the capsule behind and part of that inflammatory tissue behind, the patients bounce back partially and they continue to suffer from the many breast implant illness. So it is imperative and integral for the patients to choose a plastic surgeon who exclusively explants, who believes in breast implant illness, extremely important. And in today's age, where the FDA has acknowledged BI exists, there should be no plastic surgeon who should be augmenting, because we know it certainly afflicts all. That is 100% of the patients. Look at what the FDA said. Someone asked me when they were interviewing me, in regards to how many of the patients will get breast implant illness. And I said 100%. And they said, well, we beg to differ. And I said, well, look at the FDA warning. It says that breast implants are not meant to be in the body forever. And the average lifespan is 10 to 15 years in the human body. And as you will see from my practice alone, there are many patients I've taken care of where the patient has had a silicone rupture, silent rupture in 3 years, 4 years. And look at the manufacturer warning itself. They say the Mentor manufacturing company, the breast implant, which is the number one producer of breast implants, they have clearly accepted and said this in their publication. Any lady that gets silicone breast implants must get a MRI at year 3 of her augmentation, and then every 2 years there onward. So that means if the patient has had implants for 10 years, she should have gotten at year 3, at year 5, at year 7, at year 9. So 4 MRIs. And I will tell you, the insurances will never approve and do not approve. And so there are many patients who have what are silent ruptures. And again, as we clearly know, the longer the patients have implants, the higher the chance of rupture, especially after the 10 years, where the rate of rupture goes up significantly, exponentially high. So going back to your question, which is a very heavy question, the first and foremost thing is you have to go to a surgeon who accepts BII exists. Would you go to someone who cannot solve your problem, who does not believe in the problem? Absolutely not. First, you have to accept the fact that BII exists, then only can you do the surgery right. Number two, if you believe in BII, why would you harm another person or another patient? And this is where we have taken the oath, do no harm. So the plastic surgeon should not and cannot and must not be augmenting if he truly will do the surgery right. Because at the end of the day, this is all what it boils down to, that the plastic surgeon is fixated, determined, religiously motivated, and believes that the post-operative bounce back of the patient to a normal state of good health is dependent on the surgeon for her or him to completely and definitively remove the whole capsule. Because if that's not done, then that burden, that inflammatory silicone toxicity burden, will be left behind, and the patient will continue to hurt and ultimately will likely need another surgery to definitively remove this burden. And we know this because the patients who have not had a successful surgery the first time by a surgeon who thought he could remove all of the capsule and the inflammatory burden, then the capsules were removed by the other experienced surgeon, then only did the patient bounce back. And we have a lot of patients in that category who unfortunately had to now get a second surgery in order to correct the problem.
You know, I love your passion behind this. What really drives that passion for this?
See, for me, I will say when I very first time in the operating room saw a ruptured implant, I was totally shocked. I was very much aghast. I was very much like, what is this? And this does not look right. This doesn't belong in the patient. And I will tell you, you bring any third grader, you bring any male, female into the OR and let them see and visualize with their own eyes this. Now, when I was a med student, I saw this. Now, when I became a surgical resident, we did a lot of mastectomy patients, breast cancer patients, lumpectomy, radiation. I saw the many patients who ultimately got implants, had problems with chemo radiation, implants falling out, infection, capsular contracture, asymmetry, the fact that they were getting ruptured or they were traumatized, the pectoralis muscle was compromised as a result of placing the implant below the muscle. I saw the many patients who physically were in pain as a direct result of the surgery itself, just because of the sheer nature of how the surgery was done, the technicality of the surgery, the loss of nipple sensation, the double bubble deformity, along the many other symptoms, problems that occur with breast implants, plus the fact that, these silent ruptures and all these problems. And I said, I'm not going to do something that I strongly believe from the bottom of my heart should be banned. And this is where in 2003, when I was in the surgical training, I knew at that time where the implants are only banned. Remember, silicone implants were banned at that time. They were initially banned in 1992, and they were reintroduced into the market in 2007 when determined to be safe, the new cohesive, the newer generation implant. So very early on, I said, this is the #1 plastic surgery procedure. I can pay all of my med student loans. I can bet a nice car, house, and everything else that we all think of when we become plastic surgeons, very bluntly. And I said, you know what? I'm not going to feed my family. I'm not going to enjoy, quote, this fruits of the hard labor by hurting others. And I said this because of what we clearly see. Would you want to get, we live in the Motor City. And so I say this, if I tell you, we sell cars here in Detroit. If I tell you that you buy this car, it's only going to last you 10, 15 years and it will break down, maybe sooner, right? You have a car that might just blow up. This is the cancer, or a car that's going to give you transmission problems, or might give you axle problems, bearing problems, or whatever, electrical problems. You're not going to even look at the car, right? This is the same thing. If I tell you, a young 22-year-old college student, if you get implants, you might get cancer. You're going to keep them for 10, 15 years. So if you're 22 and you live to an average age of 82, the average American woman, technically in those 60 years, you're going to replace the implants at least 5, 6, 7 times, if not more, right? And this is what the FDA is telling you, right? There's and plus all the hurt in the middle that I just said. So I said to myself, I'm going to do everything else. Plastic surgery has 3,000 procedures, so I did a lot of hand, face reconstruction, the skin cancer, things like that, lower extremity, artificial skin, burns. I'm critical care and burns trained as well. And so I did everything else. And there was once a patient that came and she said, oh, can you remove my implants? And I said, sure. And I said, you know what? I will do it better than anyone else because I know why. I, as a board certified plastic surgeon, never put them in. And I learned, and as a undergrad in biochemistry, I understood the chemistry of these heavy metals, the mass spectroscopy, electron microscopy, and how the silicon is picked up on energy dispersive x-rays, for example. So I understood the science behind it. And so very clearly, and I'm very humbled to say in my short career, I see right before my eyes where literally without any exaggeration, all my colleagues would be like, oh, you are exaggerating, you are hyping up a problem that truly is in the minute 1.8, 2.4%, as like the brochure says. Now you look, you have the FDA, and now today, if you look at my Facebook private breast implant illness support group page, mentor is told that you have to put down the FDA warning. As of October of 21, the plastic surgeons are mandated to discuss with their prospective patients who are going to get augmented that these 3 problems, that they're not meant to be in the body forever. The breast implants are not meant to be in the body forever. The breast implants are associated with lymphoma, and they're basically replete with problems or what are called breast implant illness. And this is basically what I'm seeing in my career of what is translating into ultimately, hopefully very soon, a permanent ban on silicone, be it saline or silicone breast implants.
Terrifying information.
Yes,
Knowing
yes,
how many women
absolutely.
don't even know this.
Yes.
Yeah.
There's one BI group that I belong to, Dr. Khan, and I'm sure you know of all of them out there. But in this has almost 200,000 women.
Yes.
And I follow your Facebook site as well, and the stories are alarming. My story is just one, and I thank you so much for bringing this awareness and the letters that you have written to government officials, and to try to make it where there is true informed consent. And
right. Yep. Very important. See what you're doing right now. We are being the leaders. You are being the leader. We all are now being the leader, not only for the United States, but for all mankind, i.e. there are patients in South America, in Europe, in the Middle East, in the Orient. You have a lot of patients all over, approximately 34 million people who have implants, and they're all ultimately in the process of being hurting, or unfortunately have suffered a lot unnecessarily for a lot of information that we know. And this is clearly, I myself, I have reached the FDA director, Dr. Shuren. I called his office multiple times. Unfortunately, I have not heard. And using my own cell phone, calling him, leaving messages saying this is he, and I've written a letter to him. I've written to the state legislature here in the state of Michigan. I'm doing the level best I can, such that, the patients know that they have relief and that there is a solution, and that they're not crazy, because believe it or not, as you are aware, they are told exactly this. And not only my patients, I'm told that I'm crazy. And I'll say this, I'm not crazy. We have a mountain of evidence, and the mountain of evidence are the millions of patients who are hurting and who are now speaking volumes. And, it's only a matter of time before our voice is going to be heard. And, I have nothing to gain from this. I just want to make the quality of life better for my patients, because this is the task that I set up to do when I became a medical student.
I applaud you for all of your efforts on this subject.
Thank you. And, I just want to say, We need to have a major task force. First of all, there should be a halt to augmentation tonight. Like this should stop right away. Number two, we need to do a lot of analysis and studies in regards to how we can find the antidote, which is the way to combat this poisoning of the body by the silicon, so that we find an antidote for basically silicon, how to manage it. We have to come up with an ICD-10 code such that the many patients who cannot afford to get the surgery done right, that basically they get their surgery and the relief they need. Just like people have gallbladder problems or a thyroid cancer, they need that removed. We need to get these patients relief. And we need to get them relief now, not like 5-10 years later when legislature passes and eventually all these unfortunate patients who are hurting. And not only them, it's their family members, their sons, their daughters, their uncles, aunts, their friends, and everyone around them, the economy, their productivity, and their life is ultimately negatively very much affected.
Definitely.
Is there one, often.
And also, if I may mention, there needs to be, from a plastic surgery perspective, there needs to be a consensus by the plastic surgeons as to how to very effectively and very definitively manage the explantation. Because if you go to 10 different explant surgeons today, right, we get on the plane and we all three of us, let's say, go and see 10 different plastic surgeons, from the most reputable hospitals to the average private plastic surgeon who are seeing these patients, you're going to get 10 different answers. And within their practice, you're going to get 10 different variations of as to how they practice. Oh, you're 71. Oh, your surgery, I cannot detect off of the rib, so we'll leave the capsule behind. Or you're on a blood thinner, or you're on an immunomodulator, for example, or a Humira, or on steroids, then you're going to get the substandard surgery, which is what I find, unfortunately. Or your surgery was hard because it's plastered onto the rib. I'm just going to cauterize the rib. No, that is not the answer. Just like you would treat cancer in all patients similarly, every plastic surgeon needs to definitively remove all of the capsule, all of the inflamed tissue, and all of the implant as one system, preferably in the end block, which is all encased, such that whatever as the inside is preserved. And if that's not achievable, which certainly it is not 100% of the time, if it's, for example, tightly adherent to the rib, at least 100% total capsulectomy must be done, such that all of the capsule is definitively removed along with the inflamed tissue. And number one, the capsule must be sent to pathology to rule out BILCL, and you have to talk to your pathologist and tell them the CD30 analysis must be done, plus ruling out lymphoma. Because if you don't, the eyes don't see what the mind doesn't know. If they're not going to rule out the lymphoma, then we have not ruled it out. The second thing, they have to take cultures. 10-15% of the time in my practice, implants are associated with bacteria. You have to return the implants to the patient. There is no purpose of throwing away. We want the patients to see what was inside their body. And you'll be surprised. I've been surprised many times where one patient has silicone on one side, saline implant on the other side on the same surgical explantation day. Another patient has basically one above the muscle, one below the muscle. Another patient she was told silicone and she has saline, or a different lot number than what was on the card that was given. So we need to give that implant back so the patient can confirm and match that this is what she had, so that if there is any problems down the road, she will be able to get the relief from, let's say if this is a textured implant, so she can follow basically up with her implant manufacturer.
Very interesting. Wow, what a topic. And I had no idea until Stacy had mentioned this. And I think this is definitely a must watch for every female out there that's had breast implants. Because
I will tell you, I have reached Sanjay Gupta from CNN, anyone, whoever, the podcast, whatever it may be, anytime, this discussion, will be seen hopefully and forwarded and shared with not only within the US, Canada, Mexico. I have patients that I've talked to from Mexico City. She got her implants as a 16-year-old birthday gift, and she's hurting. She's 29. She wants to get married. And, she's going through the whole series of all those symptoms that I mentioned earlier. Now, this is no denying the fact this is as real as 1 + 1 is 2. This is as real as diabetes. This is as real as cancer. This is as real as breast implant illness. This is another entity and another disease that is, quote, lack of a better word, man-made, right? This has been introduced. If the patient did not have the silicone implant, be it saline or silicone, the patient would not be hurting, period. And I also want to emphasize the fact saline implants are not safer than silicone. They are equally worse, if not worse, because they give the illusion they are saline. No, it's the silicone shell that imparts and slowly gel bleeds and basically leaches out that silicone that basically goes into the body. And this is basically what hurts basically the body. And the many reports of the patients who have, including this MD Anderson study of studies, and also one of the case reports, if I may highlight, by Dr. Atul Mehta, who is the pulmonologist out of the Cleveland Clinic. He did a biopsy of a patient who had saline implants, and he did a biopsy of the lung only to show that there was silicone deposited within the lung tissue itself. And this is why she was having the shortness of breath, the difficulty breathing, especially with exertion. And clearly, this was a direct, and I say a direct 100% association of the implant, saline implant, and emboli, which is leaching off the silicone into the blood and ultimately deposition within the lung. And this is the saline implant causing this toxicity. And again, also clearly seen on the CT scan, electron microscopy, and energy dispersive x-rays. They're looking at the evidence directly.
Well, I'll be sure to support your cause and share as much as I can, because this is obviously something that affects so many mothers. And when you carry this much, sickness or pain, it affects your mental health, and it affects the way you interact with other people. So what a topic to share with so many women that I know that have had breast implants. So I really thank you for all of the information that you provided us today.
Sure. And what I want to tell my prospective, listeners, don't listen to me. Listen to the many women who are now talking, and they are now spearheading this whole movement. There's 4 groups of people in all of this. You have the manufacturers, they're looking the other way, saying, hey, everything is good. Don't worry about it. Keep using them. This is the standard of care. This is your right. You have the plastic surgeons, very similarly echoing, hey, this is in a small fraction, minority of the people. Implants are safe, ignore, and just continue to augment. You have the FDA. I have to say, unfortunately, they are very passive, sleeping. They're trying to be politically correct, and the patient is not the interest. If you look at the FDA received 350,000 complaints. What did they do about it? If you receive 10 complaints, you should be responding, right? They received so many complaints. They've been relatively very passive about the whole thing. Yes, they did put out the warning. That's a very, very, very early start. This should have happened in 2010, and now you have the women who are the ones who are being affected, and they are the ones who on social media are now cross-talking, discussing, and sharing their journeys of explantation, and one patient after another convincing and telling the other patient, you're not crazy, we are in this together. And if there was only 20, 30 more plastic surgeons, this will all come to a halt like instantly. And unfortunately, we need to have more of this discussion. This is inevitably going to happen. This is now in the Cosmopolitan magazine. This is now in almost every news has covered it, for example. And now hopefully this will make it to the headlines again, and hopefully a permanent ban as to what is the detrimental and negative effects of implants. Implants only hurt the body. The breast implants only hurt the body. No one walks into my clinic and says the breast implants are making them healthier or making them live longer. Their quality of life is not better. If anything, it's worse. And if I may mention two things that almost all my patients have said. Number one, they had wished they had never gotten implants. And number two, they had wished they had removed them sooner so that they would have gotten their quality of life back sooner.
Absolutely.
Yeah.
You know, one thing that I don't think people realize when you explant, you know, every 10 years as recommended or sooner, depending on your issues, you know, each time that you go under the knife, that's not covered by insurance. So all of these procedures are coming out of your pocket. You know, when you, and unfortunately, when I had them put in, I wasn't told that they weren't covered. So, you know, when I did find out after having a mammogram and finding out they did one above the muscle on me and one below, and that you can't see behind those implants. So those patients that are getting the mammograms and they may have breast cancer underneath or somewhere that they can't, in my case, this is what the radiologist said, you know, we can't, there's only limited space then when some, and I'm like, what? I had no clue. So there's a lot that they were not telling. I had mine in 2011 and I had saline. And let me tell you, if you look at my pictures the day that I went in for surgery, and you look at my pictures like 5 days later, because I documented it, I looked like death. My coloring, the this, the that, puff, oh my gosh, it was terrible. And then I looked at, and I'm like, wow, what a difference. And I'm not alone in those groups because I belong to them. Same thing.
Now, one thing, you know, I would, again, you have a very typical standard presentation, you know, if I may mention, you know, you'd gone to the rheumatologist, and if you can share that, look at the weight loss that you have had as a result of the inflammatory burden, that water retained inflammatory weight that you had, how much almost you lost 44 pounds, you were saying, you know, of significant loss. Your joints improved, right? And you were, like I would say, erroneously labeled as a rheumatoid arthritic patient, right? And you did not, right? And so this is all, again, a very classic picture where, you know, you have all the ailments and the symptoms of breast implant illness.
You know, have you heard, I have a question. My sodium level was super, super low, and they had sodium pills for a long time. After explant, and then they started making me sick. The sodium pills started making me sick after explant. But to be honest, today, my sodium issues are gone.
Mm-hmm. See, this is, again, the adrenal system's been affected. Now, this is where, you know, it's not only the sodium, the potassium, all these other electrolytes we need to look at and see what the status of them are, what the status of the kidney is, because there is, you know, for example, diabetes insipidus, for example, or other problems where, you know, you can retain a fluid as well, you know, and again, the many ways how mysteriously breast implant afflicts the many. In someone, it may be no hair loss. And another lady, she was wearing a wig. That's how much hair loss she had. You know, but we know clearly the many signs, symptoms, and that questionnaire that I have where the ladies actually check off. And this is what I say, you're 33 and you've checked off, for example, 40 of those. And this is classically what is BI. That is my diagnosis, because you have gone through the doctor, through all these tests, you've gone to the doctor, you've gone through all these tests, and all of that has yielded nothing. And this is classically consistent with what is breast implant illness till proven otherwise.
Well, we can't thank you enough, Dr. Khan. Where can they contact you?
So please join my, you know, this is Dr. Shaher Khan in Novi, Michigan. There are not many of us. So if you type in explant now, what is very interesting is, and again, if I may mention, you know, 95% of my practice is exclusively devoted to what is explant surgery. And I talk about this, you literally share, you know, one of my very close friends who's a plastic surgeon told me, Khan, be careful. You're talking about a controversial topic. And not only are you talking about it with this passion, but you're actually showing videos and intraoperative videos. And I said, you know what? I like you. You're, vouching for me and you're looking after me. I said, tell me exactly what am I doing? I'm removing the implant. He said, you got it. All right. And I'm removing the capsule, right? And I'm removing the inflammatory tissue around the capsule. And I'm use the word removing it definitively, religiously, sincerely, without a doubt, because I'm looking at it. And I'm sending the capsule off, which is showing chronic inflammation, giant cell reaction, which is the body trying to fight off this foreign body. You're seeing histiocytes, you're seeing reaction to silica, you're seeing silicon mastitis, you're seeing silicon granulomas. So essentially, if you ask me, I'm only doing good. And I have the pathology to prove it. And forget the pathology, forget me. Look at my patients, they're so happy, right? And he said, all right, you got me. No one can touch you. And I use the word, it's not even a matter of touch. This is what we have seen, which we have shown that this is what we're doing. And it is as simple as, let me give you another example. And this is a young lady that's going to come and be a Facebook guest live on my page. She is 22 years of age, went to her plastic surgeon. Her plastic surgeon did not seriously disclose with her the FDA warning that they're not meant to be in the body forever. They last 10, 15 years. They're associated with lymphoma and they're associated with BII symptoms, the breast implant illness symptoms. 2 weeks into her, she felt sick, nauseous, not able to tolerate food, throwing up, joint pain, tingling, numbness, almost 27 symptoms. And her face looks like she went even to the emergency room complaining of, the many symptoms of breast implant illness. And she knew something was up. One of her friends, I operated on her. She said, you better look into BI. So she comes to me on a Monday and I'm like, I'm booked. And she said, I said, you're only at that time 21 days into her augmentation. I said, you know what? I'm going to get you on. I just need to get a clearance. I want to make sure, God forbid you have an adrenal tumor or a mass in the brain or whatever it may be. She got her clearance and I put her on as a case on a Tuesday the following week as an add-on. I asked my team, I said, it's okay if I add on another case. And lo and behold, yesterday was her almost 6-week mark into her explantation. She gained her 15 pounds that she had lost, the nausea, the vomiting, the GI distress, the mental anxiety, the joint pain, all those 27 symptoms. And we're going to hear directly from her. Now, luckily in her, there was a rush because the capsules had not had time to form. They normally form in the 6 to 8 weeks. And so there was a rush into me just removing her implants. And what's interesting is this 22-year-old lady also got a lift at the same time. Who does a lift on a 22-year-old? Now, she is not that big and she did not need one. And the bottom line I'm trying to say here is she bounced back. And luckily for her, she's my young patient in the shortest period of time where I've removed a set of implants in the 29 days that she had the implants. And we can see her dramatic bounce back. And you will see that if you go to my Facebook. So if you go to my Facebook now, I just want to mention, if this is, again, I will say another highlight of this. If you go and find a list, there are many surgeons who unfortunately advertise and get on a list or the top 10. The list means nothing. You want to talk to a patient who is already operated on, who's benefited and has been vetted, and the surgeon has already had a transparent record where they openly discuss, number one, they are believers in BII. Number two, they are not augmenting. Number three, they're talking about how they're doing, and their patients, more importantly, are talking to each other. So they're vetting the surgeon and making sure that the surgery is going to be done right. Because this is what happens inevitably. If a patient goes to a plastic surgeon, this is out of, let's say, 10 plastic surgeons, 9 out of 10, if not all 10, will say, well, you need a lift. And you need to do this, you need to get this areolar reduction. And vast majority of the implants are below the muscle. Just to remove an implant for me takes 4 hours because this is how I do it. and faithfully sincere commitment into removing all of that capsule plus that inflammatory tissue plus the implant as one system, the gold standard being end block or 100% total capsulectomy. Now, vast majority of the patients, these patients, they end up getting a lift and they're out in 3 hours. And I'll tell you, a lift takes 3-4 hours. How on earth are these patients getting a lift, which is a 3-4 hour operation, which is all above the muscle, a totally separate operation, and also getting what is a supposed end block or a total capsulectomy in the same time that it takes me just to. And so it is imperative, because the surgeons, many of them still believe, they do not believe in BII, and they believe that the patient just wants to look good, and they are not true sympathizers, and they're still augmenting. And you want to be very careful not to be in that situation where you unfortunately will need to go back for a second surgery, or your symptoms improve maybe 30%, 50%, but you still have that lingering BII because the burden is still left behind. So the goal here is to do that definitive essential surgery, non-cosmetic surgery, the removal of the implant capsule plus all inflamed tissue, and to send these respective tissues off to microbiology, like I said earlier, to pathology to rule out the lymphoma, returning the implants, and making sure there is no inflammatory burden left behind. And the lift, as you will see clearly in my practice, 80% of the patients on average do not need a lift. Yes, there are some patients who may not be aesthetically absolutely be pleased, but remember, the single most important question after explant is not how you look, is how you feel. And if you feel excellent and free and liberated from breast implant illness and still doing good, excellent. That's a good number of my patients. If you still need a second surgery to get a lift or to get aesthetic symmetry, so be it. Get it at a second time where you may not get an infection, nipple necrosis, or asymmetry of the nipples, because on the same day of the explant to do a lift, it is too much surgery, and a surgery that is not required all the time. And a surgery that where, as you will see when you join my and see how I do it, I have on YouTube and on Facebook and also on Instagram and TikTok, you will see how I do it and why I do it in the manner that I do. And this is where I want to tell not only my patients, but also the plastic surgeons, and this is what I was alluding to earlier, that we plastic surgeons need to group together and come up with a consensus so that we all learn from each other. So we deliver the best surgery for the patient so that when we look back and say, we could not have done a better and a finer surgery for the patients.
I agree. Stacy, any final questions for Dr. Khan?
I just want to say thank you so much, Dr. Khan. For getting, this is passionate towards me. Know many friends that have had BII. Actually, all the friends that I know that have had implants, all of them had BII.
Right.
And one just wants to turn the cheek. And so, and that's okay. So I just want to say thank you very much for taking the time out. You're a very busy man. And, if you are one of those sufferers, please reach out. In, I know people that have come from California that I had met on different sites that I went to see you. And so, he was absolutely amazing. When I asked, he showed up and agreed. Thank you.
No, thank you.
Yes,
Thank
thank
you.
you.
It's a privilege. I will say this and I'll end with this. No, thank you very much. I appreciate you having me and having to discuss with what is a real topic. To help someone, it's a privilege, especially as a physician. It takes a lot of effort, 10 years of training, 5 years of general surgery, 2 years of burns critical care, and then 3 years of plastics. This is after medical school, almost, I would say 80 to 100 hours a week easily in the hospital, as you will see if you talk to any of the plastic surgeons. This is just physical work, let alone all the studying that's separate. I'm privileged and humbled to say that I'm the only plastic surgeon who did not augment because I saw this very early on. And I'm very honored to say that I do and I practice what vast majority of my plastic surgery colleagues and physicians, I would say at least tend to disagree with. And I say this very humbly, you know, we have only one vested interest. We want to raise awareness. We want to let the patients know who are hurting that there is relief. This is exactly what the FDA's message is, that if you feel like you have these symptoms, go get the answers, go get the treatment that you need. And, you know, once you read into it, you listen to your heart, you listen to the other patients, and it will click. You will know deep down within that this is what your problem is. Once you've been worked up and your lab workup and imaging and everything has been done, and there is the right way to doing it. And make sure you do your homework. Don't rush into the surgery. Don't rush into your surgeon. You know, I can only do so many of these a year and so many of these in a week. And the bottom line here is I want to explain and share with them and what I teach. What are the signs to look for in breast implant illness? What are the signs to look for a plastic surgeon who will do your end block explant right? What and how to confirm you got your right surgery? You know, just 5 points. You know, you want to make sure that the incision was not small. It has to be big in order to remove what is a 700cc implant. You cannot remove it from a small incision. The time, an hour surgery to remove 2 large implants. No, on average, I take 4. You have to return the implants. You have to take videos of the chest wall showing complete removal. I have a reputation online about how I do it because this next patient is vetting me, and because so many hundreds and thousands of other patients have also gone through what I have done, such that they're keeping a check and balance on me as well, such that I continue to perform in the utmost professional and honest manner. And the patient's interest is the only interest that I have. So do your homework, read, talk to the other patients. Your best resource is the other patients. They have nothing to gain except for your good. Talk to the other patients so you become a well-informed patient, so that when you go through the surgery, you know what you're going through and what is expected of you and what you know your expectations are and what to anticipate. It helps with the anxiety of the surgery as well.
Thank you so much.
Yes, thank you, Dr. Khan.
You're welcome. Take care, all the very best. And it was an absolute delight and a pleasure to be here. Take care, everyone. Thank you. Thank you.
Friends, go out and smile and be kind.
And don't forget, do better, be better, and treat people better.
See you next time.
Bye.